All right, welcome back. This is the third video in our How to Write a Nursing Resume video series. So I will admit this is going to be kind of a longer video, but it's really important. We're going to talk about how to articulate your skills on the resume. So we're going to talk about how to write bullet points in a way that we are explaining your experience in a way that your future employer is going to value. So again, it's going to be a little bit of a longer video, but I will try to make it as fun as possible. This is just kind of like just a visual representation. So I'm going to be talking about how to write the bullet points that come under each experience. So these experiences could be professional experiences, clinical experiences, volunteer leadership experiences, anything that you are bullet pointing on your resume. A really good format or outline to follow for each bullet point is to start each bullet point with an action verb, then list the task you completed and the impact of your work. So let me start with the action verbs. Within each experience that you're talking about on your resume or each role that you've had, you don't want to use the same action verb more than twice. So you want to make sure that you're varying your language. You're using action verbs that accurately describe the work that you were doing. If you feel like you're kind of like running out of action verbs, you can always Google action verbs or list of action verbs. And Google actually provides you with a couple of really nice lists to use, if your brain is just kind of stuck. A lot of times on nursing resumes, I see the word assist used a lot. So I would just encourage you to use the word assist maybe once, but then think about, collaborated with, advocate, help, other words that can be used in place of assist. Then you're going to list the task. So you're starting with an action verb, then you're going to explain what you did in that role. And then you have to explain the impact of your work. If you just stop at the task, so you have an action verb task, so your resume, if you were a nurse extern, it could sound like, cared for patients, attended professional development, collaborated with nurse preceptor. It begins to just sound like the job description of a nurse extern. There's no information then on your resume about what you did in that role that was unique than others, or that explains how an achievement that you personally had. So that's where that impact piece is often difficult to write, but so important that every single bullet point has. So when you're thinking about your impact, it's helpful to think about some of these questions. So you want to think about, how did I do this? How did I do this task? Why did I do this task? You can use nursing kind of like it knowledge or it keywords in there to describe why you did something. What were the results of my work? And results in a nursing sense won't be, you cured 5 patients of whatever disease that they had, but it would explain kind of like the impact that you had on the patient, on your team, on a process maybe. And then the last question to ask yourself is, what changed because I did this? How did I help my team, my patient, the organization? So for, again, every single bullet point, you want to make sure that you are adding that impact and you're using these guiding questions as a way to help you kind of get at what you did specifically for this employer. Okay, so let's shelf the action verb task impact outline. And now we're going to talk about the job description and using the job description to help us figure out how to write the content of our resume and also what to put in our resume. So some of you in sitting, watching this video, you might have had a completely different professional life prior to deciding to go back to school to be a nurse. You might have been in marketing or pharma or education or literally anything else. You should use the job description as a way to discover like what pieces of your background you would want to highlight. So what is worth leaving in the past and not talking about on the resume, and what is worth adding to the resume because it makes you more unique, or it shows how you developed a skill in kind of a different way, or it shows your achievements in a different industry that are also achievements that would be valued in nursing. So again, leaning on the job description to figure out kind of like what needs to make it to the resume, what gets packed in the suitcase. The job description is also helpful to help us use language that is similar to what an applicant tracking system will be looking for and what a human reader will also be scanning your resume looking for. So the language that's used in a job description, it's very helpful if you use that language also in your resume. So not recopying the job description onto your resume, but like using their language, their verbiage. If they're referring to patients, you're using the word patient. If they're referring to clients, maybe you're using the word client. That's kind of what I'm talking about here. If you're applying for a job and it either doesn't have a description, so it came through your network and someone's like, you should apply for this. I don't have a description, but send your resume to this person. Or if you're looking at a job description and the description's like 2 lines long and it doesn't really give you a lot of that verbiage, that information that you're looking for. The NACE, the National Association of Colleges and Employers, every year puts out a list of core competencies that employers are looking for in candidates or potential hires. And here's that list. So when you're thinking about either your work that's directly related to nursing or your work from a previous professional life, you would want to think, you know, how did I critically think in this role? How did I use my communication skills? How did I work with my team? How did I demonstrate my competencies, my competence with technology? How did I show leadership? How did I show that I am global and interculturally fluent? And you can use this list as kind of like a guide to figure out what information to add to the bullet points under each of your experiences. So I'm going to give you a few examples. So now we're going to tie together how to use the action verb task impact outline and how to align your language and your skills with a job description. So I'm not going to bore you by reading this entire job description, but this is just one that I randomly found on the internet. But you can see it's actually a pretty robust job description, and they're using really great words here to describe the work that they need their future nurse to do. You know, assess resident mental health needs and report changes to physician and family, create and maintain resident charts, noting all pertinent information within the chart, and so on. So, okay, now here's where we're going to put it all together. So I took one of the bullet points from the job description and kind of showed an okay bullet point example, but then elaborated on it using the action verb task impact formula. And then also kind of outlining what skills that new bullet point would say to an employer that you have, rather than specifically spelling out, you know, I'm a good communicator. It's inferred by the way that you're explaining your work. So the job description bullet point was assess resident health needs and report changes to physician and family. So on your resume, a bullet point that I've seen on a nursing resume before is cared for patients. It's like, okay, that is probably what you did, but let's think about how we can enhance that more and how we can make it more unique to your experience. Assessed needs of 5 critically ill patients per shift and reported vital sign changes to nurse and documented with Epic. So this is showing that, yes, you did care for patients, yes, you assessed their needs, but it's explaining the impact. You did this for 5 people, they were critically ill, you communicated with a nurse, and you documented in written communication on Epic. So this is not only showing your impact, but it's also demonstrating that you have critical thinking skills, communication skills, you can have, you pay attention to detail, you have competency with technology in Epic, and you work well as a team. Here's another example. Administer medications and treatments as ordered by attending physician. So when you are in your clinicals, a lot of times you might not be actually administering the medication, but you might be observing that someone else administer medication. So here we have the bullet point, observed medication administration. Okay, that's fine, but let's have a little more detail. Observed IV medication administration and supplemental treatments 10 times per shift and learned to interpret physician's orders. So this is, again, we're having that piece of that medication administration, which is what the job description is looking for. And it's saying that although you weren't the one following the orders exactly. You were learning how to interpret what a physician would be ordering. This again shows attention to detail. Obviously, when you're giving medications or you're learning to give medications, detail is very, very important. And it shows that you have this nursing skill of, learning to give medications. Okay, so some of you, again, you might be sitting here thinking, like, what do I do with experience that I've had? Like, other than my clinicals, I don't have any other experience that's directly related to nursing. So, like, what do I do with other experiences that have no relation to healthcare whatsoever? So I would recommend to you that you think about these experiences and you think, are they recent and are they relevant? So recent within the last 15 years, relevant. Did you learn any of the core competencies that were outlined by NACE? Communication, teamwork, critical thinking. I would leave out what you don't need, and I would focus on what you do need, what you could bring to the resume to make your resume more unique than others. You could place your experiences that aren't exactly related to nursing in, like, let's say that you were a director of marketing for I'm a runner for a running shoe company. You could put that experience, because you were the director, that shows leadership. You could put that experience in a different experience section. You could call it management experience, or you could lump it into your professional experience section. In the bullet points that you are using, you are only going to explain the transferable skills that are valued in nursing. So, communicating with your team, you're going to have to communicate with other nurses on the floor. Maybe, I don't know exactly what a marketing director does. I probably should have picked a different example, but don't worry. I have another example for you guys. So let's imagine that you did work in marketing. So the job description bullet point says assist in performance evaluations of certain personnel. So that was one of the bullet points from the previous job description we were looking at earlier. As a marketing manager, you trained new employees. That is directly related to the job that you're going to pursue as a nurse. So you would want to kind of explain that work in the marketing sense in a way where it also makes sense for nursing. Trained 5 new employees per quarter and provided supervisor with feedback regarding progress after 60 days. So that is something that you might be called on to do in this new role as a nurse. You're training new employees, and then you're also providing feedback, because it says that you would assist in performance evaluations. So this is showing that from your marketing experience, you've developed leadership skills, communication skills, and career management skills, because you don't just become the director of marketing like that overnight. So again, I would encourage you to just think about your previous work experiences that may not be related. If you worked as a waitress, like prior to being a career counselor, I worked as a waitress for like 15 years. But, learning to kind of like interact with the public was really helpful. Learning to infer the needs of other people. If I could kind of tell like somebody's drink was getting low, I could just bring them another one. These things were helpful in being a career coach too, like learning to intuit, learning to communicate. So those are the skills that I would use on my resume to highlight my waitressing experience. Not necessarily that I, sold 15 specials per shift or something like that. That's not going to be as relevant to the job I'm applying for. All right, I'm going to stop here. In the next section, we are going to go over your clinical experience and how to add that to the resume. Thank you very much.